When patients have had symptoms for the first time, usually the first step is an MRI. The MRI can ultimately assess the brain parenchyma, that is, the brain tissue, and see whether small strokes have already occurred. These strokes can be seen as small bright spots on the MRI sequences.
Diese Schlaganfälle kann man als kleine helle Punkte auf den MRT-Sequenzen erkennen.
The MRI is also capable to show the vessels. This is a so-called MR angiography. Here you can already assume that the blood supply of the brain vessels may not be normal. At this point, the suspected diagnosis of Moyamoya disease is often made for the first time. To confirm the suspected diagnosis of Moyamoya disease, a conventional angiography is needed. This is the same examination as a cardiac catheter examination, except that the vessels of the head are looked at.
The
angiography will then show that the vessels are stenosed or occluded, and that the first collaterals have been created to bring more blood to the brain. The angiography can then confirm the diagnosis of Moyamoya disease with a high degree of certainty. In order to determine whether the amount of blood in the brain is actually sufficient in the case of Moyamoya disease, there are special imaging modalities that are only available in large centers. I would like to mention two methods here. Firstly, the so-called breath-hold fMRI imaging. This is a special MRI imaging in which the patient has to hold the breath for 9 seconds during the examination in a repetitive fashion. This changes the CO2 content in the patient's blood and thus the blood flow of the vessels. This examination can already give a very good idea of whether the blood flow in certain areas of the brain is sufficient or not. However, the most important examination in most cases is the so-called PET-CT examination. The PET-CT examination is a nuclear medicine examination in which a specially enriched fluid is injected into the vein of the patient. This is then evenly distributed in the brain, and the amount of enriched fluid in the brain can be measured using the scanner. A drug is then injected, which actually causes the vessels to dilate. If the vessels in the brain dilate, the blood flow in the brain should increase. In Moyamoya patients, however, this may not be possible in certain areas of the brain, because the inflow is impeded by the narrowing of the vessels. In these patients, one would then see that the blood flow is not increasing, and thus the so-called Wasserreserve is insufficient in these patients. This would then be the decisive examination to determine whether a patient needs a bypass or not. In addition to the pure measurement of blood flow, there is another examination that is very important for determining the current status of the disease, the so-called vessel wall imaging. This is a special MRI examination that can also only be carried out in large centers, where the high-resolution MRI can be used to precisely assess the vessel wall. This precise assessment of the vessel walls allows us to see whether the vessels in the affected segments are enhanced by contrast agent and then shows us that the disease is currently active. That is, that the narrowing of the vessels is currently progressing. However, there is no need to worry. This is a very slow process overall. When we see activity in the vessel wall, we know from experience that the occlusion of the vessel usually takes a long period of time, up to 12 to 24 months.